All right, everyone, welcome back to another episode of Forward Physio. I feel very fortunate to be sitting with Meredith Grossman this morning. And Meredith is someone that I came across on social media recently, and your content is all about, burnout and communication with patients for the most part. And I find it a very refreshing page. You're one of the few accounts when I'm on Instagram scrolling that actually sort of calms me down a little bit. And I always walk away from one of your videos feeling either refreshed or a little bit calmer or a little bit just like that I gained some valuable insight. So I think what you share is really, really valuable. And I think it's so valuable because you're addressing something that's incredibly common in our profession and in healthcare in general, which is, burnout and communication issues. So thanks again for coming on. Would you mind giving yourself a little bit, or giving everyone a little bit of an introduction about yourself?
Yeah. Well, thank you for having me on, Noah. I'm really excited to be recording my first podcast with you. My name's Meredith. I'm a doctor of physical therapy. I went to Ithaca College, graduated from their PT program in 2019. I'm originally from up north from Pennsylvania, and I have worked as a PT in New Orleans for my whole career for the past 4.5 years. And so my first job was in an inpatient rehab hospital, which was like a private for-profit kind of joint venture.
Mm-hmm.
And I started my career in the beginning of 2020, which is relevant because this was, I was probably working as a PT for 4 months before COVID hit. And then because I was in a rehab hospital, I worked through COVID and was going into work.
Wow.
So I chose to go into inpatient rehab because my last clinical was in an inpatient rehab unit in a university hospital. And that was really the first time that I really felt inspired and excited about the profession. I think I was going into that clinical a little bit angsty of I've had these other kind of outpatient experiences that were okay, but I wasn't really excited by them. And then in this facility, I was working on a multidisciplinary team. I really felt like we were all kind of working toward the same goal. It felt very patient-centered. I also felt really supported in terms of, the learning and the growth of me as a student and my CI were prioritized. And so that was kind of I was like, okay, I see the light. I'm going to go into inpatient rehab. This is where I'm supposed to go. So it brought me down to New Orleans is where I found the job. And pretty quickly I realized that whatever it was that made that clinical so rewarding was not necessarily intrinsic to the setting. And so it was, the priorities were very different. It was much more of sort of a heads in the bed kind of focus, get the minutes, make our scores look good. And so, and then of course COVID started, and then kind of seeing how the priorities played out in relationship to a global pandemic. And I just really quickly became pretty jaded and pretty, I would say a little bit outraged at what I perceived as a healthcare system that just really isn't about making people better.
Right.
And so it was coming out of that experience is what led me to kind of start researching burnout and learning about burnout and going down this road of exploring what it actually is, what's really happening here, and why are so many healthcare providers experiencing this.
And in your opinion, why are so many people experiencing it?
Well, I think it's a mix of factors, and I think for different people in different situations, certain factors will weigh more heavily than others. I think the one of the biggest misconceptions about burnout is that it is all about workload and volume. I think that's really, especially in physical therapy, I see that as where the conversation centers is around these kind of mill settings.
Mm-hmm.
Going into the field, that was kind of what I had on my radar as well, which was like I don't want to work in what I see as like a PT mill. I know that in inpatient rehab, it's going to be a lot of one-on-one. It's not going to be a lot of patients per day. And so I thought that that was enough to protect me from burnout.
Right.
But what we know is that that can be part of it. That can be a big part of it for some people. But there's also these other elements of values and of feeling like we are effective in our role and effective in what we are setting out to do, that that can weigh at least as heavily as the element of, you know, exhaustion or overwork.
Yeah, you've made the point before that it's not the same as mental health, and I think that's another thing that we often conflate burnout with, the high workload. And for myself in the past, when I was in my first year of practice, there was one point where I was working like 50 hours a week in the clinic. Someone was, he fell ill, so I sort of stepped up and took his role. And at that time, I felt like I was working so much and I was exhausted. And then I said, hey, I'm burnt out. So I feel I relate to that. And I think that is when most people talk about it, you know, when they have a really, really high workload. But I think we also always talk about it like it's a mental health problem. Do you think that's the case? Do you think there's interplay between the two, or are they just completely separate entities?
Yeah, there's absolutely interplay, right? It's a mental emotional experience is what burnout is, but it is a it is its own recognized phenomenon of a relationship essentially between a person and their work.
Mm.
And so it, you know, I think with the mental health focus, my issue with that is that the kind of the answer becomes, you know, focus on yourself, exercise, meditate, you know, take care of your mental health. But there's this kind of the root of the issue is a fractured relationship between a person and their work.
Mm.
And unless we're addressing that relationship directly, I think we are not really reckoning with the burnout problem.
Mm. I just got a flashback to online physiotherapy school because it happened during COVID for me. And when people were feeling burnt out, that like, and I don't want to knock on school. I had a great time in school, but that was the advice that we got as students to try and take care of our mental health, like, you know, like take walks, meditate, be mindful, all that sort of stuff. But really, I think a big issue was that the format that we were learning on was just not what we were hoping to have from physio school. So in your opinion, what is the recipe for disaster between a workplace and someone working there for instilling burnout?
Yeah, that's a good question. I think some of it is going to certainly depend on the individual and on what is important to them in their job and in their work. Um, but you know, we know that there's kind of these 6 areas of work life, right, that have been studied in the burnout literature that we can correlate to a burnout experience. So a big one, for example, is control. So if you're in a situation as a provider where you perceive that you don't have control over your schedule, over your care that you're delivering, over, you know, your just your experience, or the way that you kind of navigate your workspace. If you feel like you don't have control there,
Mm-hmm.
that is a really big risk factor for burnout. We can also look at things like reward. So if you sense that you are rewarded both externally and internally for the work that you do, that is a protective factor against burnout. If you sense that you are not rewarded fairly or enough from both, again, like an interpersonal internal level, or from like a compensation level, that is also going to play into burnout. Values is another really big thing. So if you work in a space where the values align with yours, if you if you're in a place that is really driven by what drives you, which is helping patients get better, giving the best possible care, whatever is the reason that you went into this field, if you feel like that resonates in your workplace, that's really going to be a protective factor against burnout. If you work in a place where the only thing that your superiors or boss is talking about is the financial side, right, and getting the billing done and whatever, then that's that is, you're going to be more likely to experience burnout.
Unless you're someone who only cares about the financial side of things, which I think in healthcare is a little bit more rare.
Right.
Yeah.
Right. I mean, I think that's the thing. And I think that's a big reason why it is so common in healthcare, is because specifically people in healthcare came into this field with kind of a values driven like motivation, right? And so we're coming in here kind of expecting for our work to be meaningful. And when we're not accessing that meaning, or when we're seeing that meaning is really kind of being bulldozed by these other incentives or priorities, that can be a really disheartening experience.
It can be, for sure. And I think the journey from being a new grad to a new clinician, it's often this road that's faced with a lot of reality checks. Like, oh, there's not rainbows everywhere in this career. And there's a lot of things that I feel like do go against people's values in the real world. And I just, there's so much, like when it comes to, I'm personally in the private practice setting. And I think there's so much of a component of it that's profit driven, and it makes sense because people started a business and it needs to make money. It's really hard, I think, to balance the owner's sort of goal of having a successful business and all of the workers' goals of, having their values met here, of being able to put their best foot forward and help people to the best of their abilities and make a difference. How do you think clinics can do a better job at making that the case in a practical setting, or in a practical context?
I think the one of the biggest things is just addressing this issue that their clinicians have, and acknowledging that it is an issue, and that it's not just something that is an individual problem. I think, it is the way that a clinic is set up, the way that the schedule works, the way that the workflow works, is going to either facilitate or inhibit someone practicing in a way that feels effective, that feels like it has integrity, it resonates with their values. And I think that for the most part, I don't see a lot of clinic owners or managers even addressing that or acknowledging that it has an effect. Again, it comes back to, mental health. Well, just take care of your mental health. We don't want to talk about the systems that are contributing to this this dissonance that you're experiencing around the quality of the work that you're able to do. And so I think just being able to start to have a conversation about it, and also I think to approach the issue with some creativity, because what I see a lot in kind of the management coming from managers is like, well, reimbursement is decreasing, so we just have to you have to see more patients. Like, that's the only road that we can go down here is by cramming your schedule. And I honestly just think we need to be more creative than that.
Yeah, or like, or then giving everyone a pizza party or something like that.
Right. I mean, it's a sustainability issue. I think we can't just keep putting providers, we can't just keep jamming these pressures onto providers and expecting them to stay, to stay in the job, to stay in the business, to stay in the field. It's not, it's just really, I think we need to get more creative about how we approach this problem.
Yeah. I don't want to put you too much on the spot, but from your reading of the literature, are there any numbers that you can recall of like how common burnout is in the physiotherapy context?
In physio, I don't have a number off the top of my head. And in general, in healthcare, it tends to vary a little bit by specialty, like looking at physician specialties or nursing. And what I can say is generally the number falls around 40%. I see ranges from like 30 to 60% or so. And I think another thing with burnout is, of course, it's like most things, many things, it's a spectrum. Right. So there is like an objective, outcome measure, if you will, for burnout that I think has some kind of cutoffs for severity level. But I think I said in one of my videos, to me, it's not a question of whether burnout exists for you. It's a question of the extent to which it shows up in your life, the frequency, the intensity. Because I think it's a small subset of providers that, at least that from what I can see, that are truly thriving and truly immune from the effects of burnout.
Yeah, it's certainly a huge problem. And I think the common advice is like, just take care of your mental health, or even worse, just like toughen up, push through type of advice. It's clearly not the solution. If like maybe for one person that could be the solution, maybe, but if 40% or so of people in healthcare are struggling with this, clearly there's more of a systemic issue there. And these creative solutions are really what's required, I guess.
Right. I mean, I think I never want to knock or minimize mental health or mental health care.
Yeah.
Right. Like, I am a big proponent of therapy. I go to therapy myself. I find it very helpful. I take care of my mental health. Like, that is part of what I do, but that is not what I do for my burnout.
Right. Right.
Or it's a piece of it. It's important for everyone to take care of their mental health, but we can't. Yeah, I think you're absolutely right that we can't kind of pose this as the burnout solution. And I think, unfortunately, I think a big barrier to us addressing this on a more systemic level is that in some ways burnout interventions are really counter to the interests of the people who own the company and who run the company.
In what way?
So well, when we think about control, for example, I think a big piece of burnout recovery is kind of taking some control, right?
Yeah.
And that can look like an organized form in like a union, or it can look like an individual level of setting boundaries and saying, I'm not going to take on this extra role because I don't have the capacity for that. Actually, I'm actually a human, and I can't just work, infinitely hard and spend this much of my energy on this job. And so, I think that I think it's going to be difficult to find a lot of companies who are receptive to that kind of burnout recovery coming into their workplace,
Yeah.
because it is going to challenge the power dynamics, and that's maybe not something that they're willing to risk, even though I would argue that it is in everyone's best interest ultimately, right? For, again, thinking about the sustainability of healthcare, of people staying in healthcare, and being able to continue to function in these systems. I think it is ultimately in everyone's best interest, but there's a short-term cost to that for sure.
Have you seen that sort of solution work out successfully before, or heard stories? Because I'd imagine there's a lot of people DMing you about burnout.
Yeah, yeah. Um, I I recently ran a program for it was a course of sorts for burnout, and um, yeah, I was talking to one of the participants in the program, and she has really one of the big changes she's made is really implementing boundaries around her workload in her practice. So, not squeezing in the extra patients, um, not jamming up her schedule, and it has been so far for her successful. I think that a lot of I get comments or DMs of like, oh, I just can't do that. Like I would lose my job or whatever. And I think sometimes that's probably true. And I think other times there is less pushback than we expect, or less resistance than we might actually be anticipating. I think ultimately we forget sometimes that like our managers or bosses or whoever are people too. And oftentimes when they're jamming up our schedule or whatever, like they are kind of taking the path of least resistance for themselves, right? Like they're trying to, do what they need to do and do their job. And the way that they see that to do that is by, giving you more work. They're not necessarily thinking about your capacity or, like your relationship to your work. And so, but sometimes when we draw the line, when we set the boundary, again, they're people. So a lot of times I think they're going to be more understanding than we maybe anticipate. Again, can't expect it. Not always going to be the case.
Yeah.
But definitely something that, in short, yeah, I have seen people do this successfully.
Okay, that's good to know. I saw a video of you on boundary setting, and an example of how to do it well, and an example of how it maybe wouldn't go so well. And I think a point that you've made in the past is that burnout can really affect your communication with your patients, with your employers. And I think it would be really helpful for people to sort of recognize the signs and symptoms of burnout so that they could recognize it within themselves. So how can burnout affect communication? What are some other signs and symptoms of it?
Yeah, I think some of the big ones that I see, especially in physical therapists, is like dreading patients or dreading people coming in, sessions feeling really long, just feeling like anxiety around patient interactions, kind of like hoping people don't show up, or feeling really like like, that feeling of like, oh, I just need the next person that comes in to be like having a good day.
Right.
Like, I just need them to be like in a good space,
Yeah,
because I can't do any emotional labor right now.
yeah.
I think the combination of struggling to turn off outside of work, but also struggling to be on in work, like struggling to be present. Um, it's, think about like the Sunday scaries or just the scaries
Yeah,
in
in general.
general when when thinking about work. Those are all signs that I think are that to me point to burnout is here. Burnout is playing a role here.
Yeah, I've had those. So yeah, that definitely rings true. There was one time.
Yeah, and
Sorry, go ahead.
you go, yeah, go into your story.
I was just gonna say you posted this question to some of your followers once, like, I'm taking a mental health day. How often do you guys take mental health days? And I was very curious as to the proportion there of the people that said that they do and they don't, because when I am feeling like that, I am in a healthcare setting where I feel like I have to sort of push through to the weekend because I lose money when I'm not in the clinic, and financially it's set up in a way where mental health days are very costly. In a way, I feel like I'm paying to do them. So I feel like I just have to power through to the weekend, which obviously has its issues if a mental health day is really needed. But yeah, just you saying all of those things, I've felt those in the past for sure. And I'm sure I'm not alone in that.
Yeah. Yeah, I was surprised by the end of that poll. It was about 50-50. It was it was not exactly 50-50, but it was something like that. At first, it looked like it was really tilting towards people not taking them. And then it kind of came back to closer to 50-50. But yeah, that's a real barrier. I mean, especially in the United States, most people's time off is pretty limited. It's
Mm-hmm.
like maybe 2 weeks, and so people don't want to take days off. And I'm in a similar situation as you, in that like I have time off, but also, like, for example, I have a trip coming up. So because I took a day off here and there, I'm ultimately going to take some unpaid days on that trip coming up. And that is something that I have become more accepting of and willing to do. I think I used to be very resentful of that and resistant of that and stubborn about that. And again, I can see that for a lot of people, and depending on your financial situation, it's more or less of an option.
Right.
Some people, it feels like it's too tight. It's not an option, and I am fortunate to feel like I have enough leeway to be able to do that. And I guess part of my rationale is like, if I really burn out, I'm going to need a lot more than a day off. If I
Yeah.
have to leave this job and really like reassess and do that, I'm going to need to take a lot more than one day off. And it's going to cost me a lot more than this one day's worth of work.
That's smart.
So yeah, it's part of it. I think it's still something that it sucks. I'm not going to lie. It
Yeah,
sucks
yeah.
we're already not making a ton of money here, and then to cut back even further. Yeah, it does suck.
Yeah. So one last question on burnout. If you were a clinic owner, or
Mhm.
if you were sort of running a physiotherapy unit in a hospital, what are some key things you would do to prevent burnout for your employees? How would you set it up?
I I think that the first thing I would do is arrange to meet with people on like one-on-one on a regular basis. And that's something from just reading about management and reading about leadership that is generally shown to be beneficial is like meeting on a regular basis with people on your team, one-on-one, checking in with them, seeing what their sources of difficulty are, what their challenges are, and playing a role in helping them navigate them. And that is something that myself, people I know in healthcare, I don't know anyone that has that sort of relationship with a boss in healthcare. That is like, checking on them, not just from a performance standpoint, but also personally, and also about their goals and, what they are, where they see themselves going and what's important to them. I think that is a big piece of it. I think that centering conversations around the patient care, which seems so basic,
That's so rare.
is again, yeah, but again, that's like, that is what engages healthcare workers. That's what makes them click, right?
Yeah.
Is helping people and getting them better. And I think because a lot of bosses experience financial pressures, their kind of instinct is to talk about financial pressures with their team. And so I think if I was in that situation, I would make it an effort to not focus, conversation with staff around the financial pressures. But rather on like what we need to do to deliver a higher quality care, for something like no shows or cancels. Like, what do we need to do, not just to get our no show cancel rate down, but to like reach the people that are no showing, right? Like to give them care that they are going to show up for, or how can we like navigate that situation from a patient-centered lens, rather than how can we get these numbers better? How can we get our scores higher, whatever.
Yeah. Hey physios, I know that we all know how expensive continuing education courses can be. What if you had the chance to learn from some of the brightest minds in the industry from the comfort of your own home, all at the fraction of the cost of those weekend courses? This is where Masterclass by Physio Network comes in. Imagine having front row access to the world's leading experts breaking down complex topics into digestible module-based video courses. It's basically like Netflix for physios, and it gives you the option to learn about a ton of different topics. If you're interested in a particular area, the chances are that Physio Network already has a masterclass on it, or they're working on one right now. Masterclass is your ticket to staying relevant, informed, and delivering the best care possible to your patients. Click the link in the show notes and use the discount code NOAH10 at checkout to get an exclusive 10% off on Masterclass. Don't miss this opportunity to elevate your expertise. If you're still unsure, test it out with a 7-day free trial. You're going to love it. It's way too common that it's like that. I think that would be I think new grads or people that are feeling burnt out should really seek out places like that, and they should probably inquire about that in an interview, right? Like, what does that process look like? And is it a thing that just happens in the first few months, or is it an ongoing thing? I think it's rare for that to occur. And again, I think, as you mentioned, it's in everyone's best interest for it to be that way, but it's so rarely set up like that, because I think a lot of owners and managers are, again, thinking about the path of least resistance and just trying to do things in a way that helps their bottom line and helps what's most important to them. But I think financially, turnover could be expensive. So again, it's even in their best interest just to make sure that their workers are happy. And the way to do that, I think in most cases in our setting or our profession, is to focus on quality of care, for sure.
Yeah, absolutely. I think it's a good point that turnover is can be very expensive, depending on, how efficient the system is and how quick you turn over the position. It can be extremely expensive. And I think a lot of places kind of look at turnover as like a cost of doing business, and something that they don't have a lot of control over. And to some degree, that's true. And to a large degree, that is, I would argue, that is not true.
Yeah.
And that if, and that there's very real factors that are driving the turnover that you do have control over. But again, those are bigger picture questions, and they're not the quick and easy solution. And so I think that it just tends to be not where the focus goes.
I think even financially, from a performance standpoint, when we're so focused on those numbers, I think just focusing on quality of care can improve those numbers. When patients are coming in and they're working with physios that are way more engaged and passionate and just have the patient's interest, at the front of their mind, I think that is good for business as well, because there will be less patient turnover too, potentially.
Yeah, absolutely. Absolutely. It all, it's all related.
Yeah.
Right.
Mm-hmm.
And I think that, there's a piece of it too that is like, I know in private practice, a lot of places are bringing in some kind of cash component, or like taking cash-based patients, or doing some kind of wellness thing. And I think if you're really focused on the relationships and are establishing and focusing on a high value experience for patients, then you're more likely to see success with some kind of initiative like that.
Mm-hmm.
That's also, I think, that's like a creativity thing of how can we make this more profitable without just jamming patients on our provider schedule. Like, yeah, that's a potential route, but how do you set it up for success? How do you put the things in place to really make it profitable?
Yeah, right. You have such a strong ability to communicate, from what you've shown on your social media. And I wanted to ask you, has that always been the case for you? Or is it something that you've developed over time? And if so, when did it become such a strong focus for you?
So it has absolutely not always been a strength for me. And I would say that, like, very cliche, but social media is a highlight reel.
Yeah.
And what I'm putting on social media and my examples of communication those are my best self. I'm not always communicating on that level. And I know that, because it takes, and still for me requires, a lot of intention and being in a certain mindset and having a certain focus. And I just want to say that and like be honest about that, because I think what I don't want the content to be, and I'm glad you said it kind of has a calming effect for you, and I'm glad about that, because what I don't want it to be is another thing that people go to and are like, oh, I'm not good enough because I don't communicate like that, right? So I think it's a skill. It's something that I myself am still building and working on. And I started focusing on it. So I work in a clinic now. I work in an outpatient clinic in an urban, like downtown New Orleans. So I see we are the only level 1 trauma center in the region. And so I will see a lot of folks rehabbing from like gunshot wounds or car accidents, like sometimes multi-traumas.
Wow.
I also see a lot of like chronic persistent pain issues. Certainly, a lot of my patients are pretty low socioeconomic status and have a lot of the yellow flag screening type of indicators. So I knew coming into this job that like that I needed to be very aware of myself and and I'm not from here, I think, is the other thing.
Mm.
Like, I'm working with people who are like culturally, and whose lives are very different from mine, and I kind of knew that coming in, and knew that the way that I navigated those relationships was going to be really relevant to my ability to help people here. And my wife, who is also a physical therapist, she did a clinical in PT school. We didn't go to school together, but she did a clinical in a chronic pain clinic that saw, again, a lot of chronic persistent pain, very debilitating type of pain. And she was telling me about how in that clinical, some of her CIs would have entire sessions that were just talking with people,
Mm-hmm.
and using things like motivational interviewing. And that was kind of the first time that I really thought about like how outpatient physical therapy can look different than what I had seen sort of more traditionally in my clinicals, for example,
Mm-hmm.
or even what I was seeing in my workplace now. And the other thing was, she was like, some patients there like never discharged. They came in maybe once a month or something on a regular basis, and it was really pretty like palliative, but they would
Mm.
kind of come on that basis. And again, just kind of got me thinking about what physical therapy is, what it can be, how can we serve people who are in different situations and different stages of change around behavior, around pain management. And that kind of led me to, like, I took a course on motivational interviewing, where I was part of the course had a live component where you could go and practice the skill with like a trainer, basically, on a call. I started reading a lot of books. I really like to read, so really dove into books on communication, and then just started practicing and applying it in practice, seeing how things landed, and started feeling a lot better, honestly, as I started to um, implement it and kind of approach my practice from this reflective communication lens. I
Mm.
found that my anxiety around certain patients was a lot lower. I was bringing another level of, again, like, intention and thoughtfulness to these situations that I was dreading, for lack of a better word.
Why do you think your anxiety around patients decreased there?
Because I think that so much of that anxiety is from a place of feeling like, not maybe consciously, but like that I need to protect myself from this patient for whatever reason. Like, I don't trust them,
Mm.
or like, I like the way that I perceive that they are interacting with me or interacting with therapy is not meeting my needs or expectations. And so I think being able to approach those situations with a really a more open mind and with more empathy. I think I, at that time, would have considered myself an empathetic person, and in many ways was, but there were situations when I was really having a hard time accessing that, and kind of challenging myself to look at those situations as not a problem with the patient, but as a problem with maybe with the relationship, or with the way that I have framed things, or like the way that communication has transpired. was that, because that's something I can do something about, right? I can't do something about someone's personality or their, whatever they're bringing to the table. I can't do something about that. I can do something about, the way that I'm showing up and interacting with it. And so that's the control piece of burnout, right? Is I have something now to control in this situation, where before I just felt like I was kind of grinning and bearing it, in survival mode, that kind of thing.
I think it's really useful for people to know that they can develop these skills, because for some reason, when it comes to communication, people feel like they either have it or they don't, instead of something that could be refined. And I think a large part, from the sounds of it, of your refining process had to do with being reflective and considering the other person and being open-minded. And I think a lot of the time, barriers to progressing in our communication or pitfalls within a conversation happen because we play the blame game, and maybe we don't look at what we can do ourselves, and we think about the patient's personality, and we think that's the barrier to them getting better. And perhaps the most famous example of that in physiotherapy is when someone doesn't do their exercises, and then we just sort of blame the patient. So as you do on your social media, can you maybe tell us how a poor example of that, a poor example of how a conversation may go around a patient not doing their exercises, and then maybe a better example and some things that you'd want to focus on?
Sure. So, with something like someone's not doing their exercises, right? I think that, first of all, I want to say that the reason that we blame the patient and don't have the skills to navigate these situations, again, to your point, is because they're skills, because we haven't learned them. I think when you think about, the trans theoretical model of change, or the stages of change, if listeners are familiar with that model, that there's essentially stages we go through in the process of making any change, which are pre-contemplative, contemplative, preparation, action. So as physios or physical therapists, we have learned action skills, right?
Yeah.
Those are we have learned how to get what actions to do. Most people that come to physical therapy are not in the action stage of change, because if they were, they would be taking action.
Right.
Right.
Yeah,
So
yeah.
the people in the action stage, a lot of them don't. Some of them come to us, or in the preparation action stage, some of them come to us. A lot of them are doing it on their own. They're doing their own research. They're figuring this out on their own. So a lot of the people that come to us are in these pre-contemplative, contemplative stages. And we're not trained to navigate them. And in fact, so what we do is we turn those into character flaws. And so I think if a patient isn't doing their exercise, there's a good chance that they're just not in that stage of change. You might have introduced it too soon, frankly. Giving someone exercises who's not has not made the mental switch of accepting that this is important to them and that this is beneficial for them. They weren't ready yet. And so I think maybe the worst thing that you can do in that situation is to number one, incite fear of, if you don't do this, you're never going to get better, or it's going to get worse, or you're going to get a contracture, or that is not a good motivator. In fact, people are more likely to reach for unhelpful coping strategies when they are afraid, right? So that fear, kind of bringing that in, I would say is not a great idea. And then the other thing is shame, which I think is more like what we do, which is kind of or just or even just avoiding and doing nothing about it. But just saying something like, you really should do these. Or, you're really not going to get better if you don't do them.
Yeah.
or again, just not speaking to it at all. And I think especially when folks are burnt out, when they're feeling checked out, they don't want to confront this situation. Like sometimes, we just won't really get into it at all. So those are, I would say, the less helpful things is like avoiding it entirely, or kind of bringing in guilt or bringing in fear as to try to drive compliance is generally not recommended.
It's such a gut reaction for so many people, I feel like.
Yeah. Again, because we don't know better, and whoever we learned it from, our CIs or whatever, they didn't learn anything different. And
Yeah.
yeah, and a lot of us have also experienced that with other providers, like with our own doctors, and it has, or even just with other people in our lives who are not medical, when we don't follow through with something that we say we're going to do. And so I would say, in terms of a more helpful way to approach it, I think that's one of the first things you can do is to take a step back and think about, like, why would a rational, reasonable person not do their exercises? Like, why would I not do my exercises? Or when have I not done something that I knew would be beneficial, but just didn't do it? Right. So really taking a moment to bring in that perspective taking, that empathy piece, and realizing that, again, this is so normal, it is so human,
Yeah.
to not do things that we know would be beneficial for us.
Right.
So really striving to normalize that, and then to kind of approach a conversation about it with a real commitment to non-judgment of the person. And I think this is where a lot of people really struggle. And it's not because we're bad people, it's just because it takes a degree of humility, and it's just, it can, especially if you're experiencing burnout or are feeling like you're in survival mode, it can make it really difficult to access that headspace of non-judgment, to explore what really is going on. What are the barriers here? For a lot of people, part of what's allowing them to exercise in the clinic is that they feel safe, they feel supported, you're there empowering them. And when they leave the clinic, they are at home, whatever their home situation is, like, they don't have that same support. And so, and that might be one reason. There could be other reasons too. Maybe it's that they don't really buy in. Maybe it's that you gave them things that they can't do at home for whatever reason.
Yeah.
Like, you gave them a supine exercise and they can't get on and off the floor, and it's like weird to do it in their bed. Like, there could be things. There's so many different, like, things that it could be, but the only way you're really going to get to that is if you can explore it with non-judgment and prompt reflection on it, from a place where you are genuinely curious about the person in front of you, and not trying to fix them, not trying to drive compliance. Because people are very perceptive, and if they sense that you are judging them or that you are threatening their autonomy, then there is a very good chance that they are going to either kind of shut down or get defensive, and that you're going to not really, that the conversation is not going to ultimately be constructive or help you really help both of you figure out a plan going forward.
So if a patient says, I didn't get to my exercises this week, I think it sounds judgmental to say, why didn't you do them? Even if you are genuinely curious, how would you phrase that question?
I forget where I read this. It might be it might be a motivational interviewing thing, but that why, the word why, so why questions often come off a little bit
Yeah.
accusatory, or are sometimes interpreted as accusatory. So I will often shy away from the why. But what I might say is something like, "Oh, okay, like what happened?"
Hmm.
Like it could just be that simple. Okay, what happened? And and then seeing where they go with that, of, oh, I just didn't get around to it or something. And you're kind of reading where they're going with it. If someone's being really cagey, or just like not really engaging with the conversation, I might back off a little bit and then kind of revisit it later on and be like, okay, so um, I know the exercises didn't happen last week. What would you like to do this week
Hmm.
in terms of the exercise? And open it up then. Like, do you want to do different exercises? Do you want to and if they're sometimes they're like, no, I need to do them. I'm like, okay, like what would be helpful for us to kind of facilitate that? Like what's getting in the way right now?
Hmm.
Exploring the barriers, right? Sometimes I will, it's something as simple as taking a piece of paper, making a calendar like Monday through Friday, whatever, and then just like doing a little box. Okay, on the days that you do this exercise, make this little mark in it. On the days that you walk, do this little mark in it. Like real simple little accountability tool. Sometimes that's what people need to kind of bring it together. Or sometimes it's that, again, that they're not in they're still not really buying in which case it's like, okay, what is one thing that we can do this week that is constructive towards our goals? Maybe it's, hey, this week I want you to like Google the effects of exercise for arthritis. Like I want you to do some research about what is recommended. That's like a preparation step.
Hmm.
So if you're not really ready to like do this exercise, maybe I can give you something to read. Maybe I have an article, and my thing this week is that I want you to read something. Or maybe it's that I don't have a clear goal right now. We haven't figured out a goal that we're working toward. Maybe this week I'm not giving you an exercise, but what I want you to do is come back with like a specific goal about what you want to see change
Hmm.
in the next couple months. So again, bringing in an element of creativity and openness and collaboration, where it's really an effort to truly meet people where they're at, but also without totally abandoning our integrity and our needs as the provider in the
Hmm.
relationship, right?
Yeah. Okay. Beautiful. I think that's really helpful for people. I think we often struggle with that, and that's applicable to a lot of different clinical scenarios. Just those ideas of creativity and collaboration and empathy, understanding, as opposed to you sort of being like as the healthcare provider right about everything and expecting people to just follow suit. It's I think helpful to again realize that we always don't do things that are really good for us, and just understanding that we all share that, I think, can really help set the stage for being empathetic and then just having that open conversation.
Yeah.
Meredith, is there any final parting words of wisdom that you'd want to give to everyone? Maybe if you can go back in time and speak to your future self at the start of your career, anything that you would want to tell yourself?
Yeah, I think the first thing I would tell myself is like you are I think like there's a message of like you are not, I don't want to say crazy. I want a different word than that, but like you are not completely off base with feeling jaded or cynical about the environment that you're in
Mm.
and about like the lack of preparation that perhaps you had to really be in the world of healthcare and navigating the dynamics of this world. I think I would give myself some validation that like, yeah, there is a lot of injustice here. There's a lot of unfairness here. And like you are, yeah, you are not incorrect to be noticing that.
Mm.
And then along with that, I would also say, which I truly believe, that there is still room here for meaningful work.
Mm.
And I think that is it is a process to create that, but there is definitely a potential for that here. And I would say the same thing to people coming into the field is that, or people even in the field now, is that yeah, there are really perverse incentives present here that we are navigating, and there is, in my belief, there is still potential for us to be impactful and to genuinely make a difference. But it starts with really kind of connecting to our humanity as
Mm.
providers within the care that we provide, to kind of getting away from these mythologies of heroism and sacrifice in healthcare that I think are really damaging to us and that we internalize and you know, in doing so kind of abandon our own needs and what's really important to us, as well as, you know, centering the humanity of our patients and really committing to that, to maintaining the humanity in what we do and how we interact with people, including our bosses, even including our management, in it within our work.
Mm.
I think that is really, really important.
Beautifully said. Okay. Meredith, thank you so much for coming on. Is there somewhere that people can connect with you or follow you that you'd recommend?
Yeah, I'm on Instagram. It's Meredith Grossman PT.
Okay.
Yeah.
Cool.
Thank you so much for having me on, Noah.
My pleasure. Really, really nice talking with you. Thank you once again for listening to the podcast. If you enjoyed it, please consider leaving a review. If you would like to follow me on social media, you can follow me at noahmandel.physio on Instagram and TikTok. Have a wonderful day, and remember to keep moving forward.